Good morning, good afternoon, and good evening, everyone. I welcome everyone who is joined today on webinar on title Leveraging SouthSouth Cooperation to Scale Up Achievement and Good Practice in Maternal and Child Health. My name is Chris Hirabayashi. I'm a regional advisor of UNICEF Regional Office for East Asia and Pacific, but I'm currently in mission to Manila. So my internet connection a little bit challenging, but if we are lost, I ask to someone to support, but I'm today's your moderator. And today's webinar is jointly organized by three organizations, namely the International Policy Center for Inclusive Growth, IPCIG, the United Nations Office for SouthSouth Cooperation, UNOSSC, and the United Nations Children Fund, UNICEF. Next slide, please. Thank you very much. And in February 2018, the three organizations jointly launched an online platform called Community of Practice on SouthSouth Cooperation for Children, COPSSC4C, on socialprotection.org, IPCIG, based in Brazil. The platform is owner of socialprotection.org platform, where this webinar is also being hosted. And I thank you, IPCIG, very much. Obrigado. Next slide, please. Slide is changing? Okay. Well, there are two key objectives for today's webinar. One is to share countries' SouthSouth cooperation modality in sharing their experiences, knowledge, and technical assistance. The second objective is to bring practitioners from different countries together in order to increase access to knowledge and technical assistance. To achieve the objective, we have a wonderful virtual panelist today.
We lost the connection from Chris, so I am Martha Santos from UNICEF in headquarters. I'm the program manager for SouthSouth Cooperation, and I will take over until Chris is back online. So we have the three presentations for today's webinar, and we will have the experience from China, from Brazil, and from UNICEF in South Asia. Next slide, please. As we already mentioned by Dr. Chris, he will be moderating and I will be backing up from UNICEF here in headquarters. So with that, next slide, please. I would like to hand over now to our colleagues in China. So the first presentation will be on the experience of China in providing technical assistance in the area of maternal and child health. Our first presentation will be Dr. Yingjie from the International Health Exchange and Cooperation Center. And then we will have one presentation from Hunan Children's Hospital, which is an implementing partner of IHECC based in Hunan. So Dr. Cao, over to you, please.
Okay. Good day, everyone. I am Yingjie from the International Health Exchange and Cooperation Center of National Health Commission of China. And first of all, I would like to express our genuine gratitude to UNICEF for giving us such an opportunity to introduce what we have done and will do in future in leveraging South-South cooperation on MCH. Our presentation will be divided into two parts. First of all, I would introduce a bit of the background of the Belt and Road MCH Training Hub project. And the second part is the best practice of this project, which will be presented by my partner, Dr. Wang Li from Hunan Children's Hospital. It is one of the center of excellence of this project. Okay, next slide, please. Next, yeah. All right. For the background, the China's achievements in MCH, I would skip the detailed data, but to summarize that China's MCH indicators have improved significantly, they contributed to the global achievements of the MDGs and was rated as a high performance country for MCH by the WHO. Next slide, please. And on the other hand, as we all know that the world, especially the developing countries, are facing challenges of MCH, and it is a long way to achieve the UN 2030 SDGs. Next slide, please. Yeah, and then next, yeah. Okay, and I would introduce my center briefly as an institution under the National Health Commission of the country for international exchange and cooperation in the field of health. Our center plays a role as a bridge and window for external communication, both at home and abroad. Our main business areas include the governmental affairs, such as the Lifeline Express to poverty areas in China, and recent years to the Belt and Road countries, and transaction management of China medical teams, medical equipment procurement, as well as all kinds of international cooperation projects with NGOs or international corporations. Next slide, please. Yeah, these are what we are doing with the in the field of health. Next slide, please. And our center has been actively participating in SSC and MCH. Since 2006, we have undertaken more than 60 foreign aid trainings from the MOFCOM Human Resources Aid projects and had trained more than 400 professionals and government officials. Secondly, our center has carried out a number of public welfare projects to promoting MCH, such as prenatal diagnosis, birth defect examination, reproductive health management, perinatal nutrition, PG's pediatric professional training, and breast cancer screening, and so on. Thirdly, more than 40 out of 57 supporting foreign countries of China medical teams have dispatched MCH professionals. At the same time, innovative projects in the field of MCH have also been carried out in several African and Asian countries. Next slide, please. Yes, these are the supporting foreign countries and the innovative projects. Next slide, please. And based on the above experiences, under the guidance of the NYHQ, our center is now working on 2 MCH projects together with UNICEF and related institutions. One is the Belt and Road MCH Training Hub project, which has been running smoothly now, and the other is the SouthSouth Cooperation Fund MCH project, which is on the way. Now I would briefly introduce the first project for you all. Next, please. Next slide, please. Thank you. Yes, I will skip the page for saving the time. Next, please. Okay. Yeah. Next, please. Sorry. These pages, the 2 project we have cooperating with UNICEF. Okay. For this project, I would do some introduction and next slide, please. Yeah. This project cycle is planned for 5 years to 2022, with its goals to promote the exchange of skills and experiences with its in SSC, especially to promote technical exchanges and share MCH experiences between China and countries along the Belt and Road road, as well as the South Asian and African countries. Next slide, please. The objectives of the projects are to establish a flagship cooperation and exchange platform, and then as well as a network of training agencies and COEs, and to design standardized training courses and curriculum, and last but not least, to develop capacity of Chinese partner agencies. And next slide, please. Yeah, these are the objectives. Okay, next slide, please. Okay, I will skip this. Next, please. Okay, as for the training hub, the training hub should deliver international training curriculum, both e-learning and face-to-face workshops, as well as field visit and clinical practice and ongoing networks. Next slide, please. Yes, these are the function of the training hub. Next slide, please. Okay, I will skip this one. Next slide, please. Thank you. Okay, this picture shows the structure of the project implementation, which contains the project steering committee, the expert consultation committee, curriculum development groups, and also the evaluation groups. Okay, next slide, please. All right, these are some pictures and activities we have done in last 2 months. I would like to share some of the our activities. The first page is the lectures, seminars, and field visits we have had last month. Okay, and then next slide, please. And these are the cultural exchanges which our trainees are quite interested in, and such as some of the pictures are in the Mid-Autumn Day of Chinese traditional festival, and also the first picture in this page is actually our website we built especially for our project. And using this platform, we conduct the demand survey, the interactions between trainers and trainees, as well as assessment and evaluation of our courses. We believe that this platform would help in the future within and within or in other project. And last picture, next slide, please. Yes, the last page of my presentation is they are the comments from the trainees, and we may see that we are doing the right things when we are communicating with our trainees from all over the Africa countries, and also the Belt and Road countries. All right, that's all for my introduction, and then I will give the floor to my partner, Dr. Wang Li, to share us with their best practice and experiences. Thank you very much.
Hello, everyone. Good morning. I'm Lily Wang from Hunan Children's Hospital, China. Very nice to meet all of you here. It's my great honor to be invited to join the webinar. So, as the only one pediatric foreign aid training hospital in China, we really accumulated rich experiences in organizing training projects. So here, I'm very happy to share with you some of our experiences and stories. Next slide, please. So let's take a look at the function of my department. So this chart shows you the management function of International Affairs Department of Hunan Children's Hospital. It is one branch of administration department directly under the hospital leadership. Such setting is quite unique among the hospitals in China. So we also, it's our great honor to be one member of the Center for Excellence. So in my department, there are 6 project assistants to support the training course. We have gathered faculties in MCH and pediatrics all over China, and we trained a group of doctors and nurses to be the translators. We also work with the local universities. Most volunteers are students from medical schools and language schools. Next slide, please. The responsibility of the International Affairs Department covers the following 3 main aspects. The first one, organizing foreign aid training, including bilateral or multilateral projects, overseas training, professional further study in different specialties as well. Second, selecting qualified doctors to join medical team and carrying out MCH relevant projects supported by National Health Commission. Third, focusing on child health with global vision, we established the Children Health Collaboration Alliance for Developing Countries last year and committed to build international academic research cooperation platform. So next, please. Next slide, please. So here are some data to show foreign aid training courses we organized since 2006. You can find out the participants' numbers is increasing rapidly these years. Up to now, we completed 87 courses and trained 2,605 participants from 105 countries and regions in Asia, Africa, Latin America, Oceania, and Europe. So the project topics covers pediatric critical care, maternal and children health care, pediatric common disease prevention and treatment, neonatal preterm baby treatment, hospital management, traditional Chinese medicine, clinical laboratory medicine, nursing techniques, etc. Next slide, please. So from these slides, you may know the top 5 recipients countries are Sierra Leone, Bangladesh, Zambia, South Sudan, and Sri Lanka. And the right 3 tables shows us top 3 recipient countries in Africa, Asia, and the South Pacific areas respectively. Next slide, please. So the second part, I'd like to talk about some SouthSouth Cooperation experiences and the capacity. So I'd like to highlight the Children's Health Collaboration Alliance of Developing Countries. On the conception of community with shared future of mankind, we built a global cooperation mechanism of MCH for developing countries, featuring intensive consultation, joint contribution, and shared benefits, in a bid to realize the UN
Lily, we lost the audio. Lily, we lost the audio.
Next slide, please. I think the you missed 2 slides. Maybe can go back to another 2 slides. I have some examples to share with you. Okay, it's okay. Maybe so. This year's we already started a very good collaboration examples. Work with National Pediatric Hospital Cambodia and Sierra Leone. And we carried out the MCH project for Cambodia and Sierra Leone in 2016. Since then on, we keep good relationship with these 2 countries. We build a very close collaboration with National Pediatric Hospital Cambodia and providing 3 years capacity building of neonatal medicine, including hospital policies, standardized NICU, basic skill training, core technologies, workshop, teachers training, and telemedicine. So this time we have a group of experts in Cambodia to making investigation in this hospital now. And also we start some collaboration with Zanzibar, since we organized 2 overseas training courses in Zanzibar, and also we become one member of China's Central East European Countries Hospital Alliance and started collaboration with Chisinau Children's Hospital in Moldova. So the funding of all these kind of program is sponsored by the Ministry of Commerce. So we also receive part of support from the local government and scientific research project funding also. We focus to follow up with the participants. Even the follow-up is not sponsored any funds from the government, so we still insist to organize delegation for return visits to different countries every year. So far, we visited 12 countries. Besides, we keep contact with participants through the emails, WeChats, and other ways. So next slide, please. So what are the key lessons and challenges for us after more than 13 years organizing training courses? Upon such questions, we have discussed with other colleagues and partners. So from our perspective, there are 4 key points. The first one is participant selection. Who are the ones should be selected to the right course, and how to coordinate the recipient countries select qualified participants to attend the training course become a big concern. For the organizer, we don't want to waste resources. We always expect better training effectiveness. So if the nominated participants are qualified and eager to learn, we will be more confident of the training effect. Of course, recruit criteria of participants is very necessary. The second point, supply-driven is rather than demand-driven when designing the course. Instead of only receiving tasks, organizers should be involved in demanding investigation. Then recommend suitable programs and making design from the professional standpoint. Third, explore appropriate curriculum is based on the demanding from all the participants. We have to know the training contents always relevant to the participants. Fourth point, how to evaluate the mid or long-term training effectiveness. It deserves our deep thought. We have to know whether the knowledge and the skills are transformed to practice. How is the participants' clinical performance in the future? What are the real outcomes after training projects? And what kind of data we should collect and to evaluate? How to work with the recipient countries to evaluate the long-term effectiveness? How often to organize the same topic training course? I think this is the most difficult one, and we are also looking forward to receive more support and help from other partners and to help us to handling such tough job and facing the difficulties and challenges. Next slide, please. Despite the challenges, we have to always move forward. So our future plan cooperation approach is focused on the 4 aspects. Based on the Global Center of Excellence on MCH, so the capacity building with focusing on children health care is our big concern. Second, overseas pilot projects. We're going to start some essential
Lily, we are losing the audio, so we will wait for it to come back, and then we will proceed with the next slide. Karin, could you put the next slide, please? Dr. Cao, in the absence of the audio from Lily, would you be able to cover the final slides? We have 2 more slides before the end of the presentation. You are muted. Dr. Cao, please unmute the microphone, please.
Okay, thank you.
Thank you.
I'm contact with her.
UNICEF.
Yes, to reconnect. 说话他们听不见，这儿没有。对。
So yes, these are the future plans for the from the Hunan Children's Hospital. Dr. Yingjie, we're just gonna proceed with the final slide because this is the last slide from Dr. Lily. So Karin, please proceed with the next slide, please. Over to you, Dr. Cao.
Yeah. Okay. These are our contact information. Welcome to contact with us, and we are glad to hear your experience in future. Thank you very much.
Okay, and so over to you, Dr. Chris.
Thank you very much. Sorry for this some connection problem, but Chinese experiences was so excellent, and maybe we can discuss later. And then we want to invite WFB team, Miss Yasmin Wakimoto, and Mr. Bruno Magalhães. They are WFP Center of Excellence Against Hunger, based in Brazil. The presentation is school feeding as a platform health promotion. And Miss Yasmin Wakimoto is a public policy expert in the program and the policy unit of the WFP Center of Excellence Against Hunger in Brazil. She holds excellent academic degrees, and Yasmin provides technical assistance and policy advice to partner countries. And Bruno Magalhães is a SouthSouth Cooperation school feeding expert in the program policy unit of the WFP Center of Excellence Against Hunger in Brazil. Bruno provides school of feeding policy advice and strategic planning and work to promote SouthSouth and triangle cooperation. So they are very doing excellent job, and the floor is yours. Please go ahead.
Thank you, Doctor. So first of all, thank you very much for the opportunity to present both the Center of Excellence, the WFP Center of Excellence in Brazil, and the school feeding as platforms for health promotion. I'm here at Yasmin, and we are going to present very quickly on school feeding pretty much as platforms. So our presentation is divided into some parts. So I'm starting with an introduction on how school feeding can be used as a health intervention. Then we move to how the Center of Excellence in Brazil and WFP in general promote school feeding as a health tool using SouthSouth Cooperation. Then we present the Brazilian experience, and then we present a Kenyan experience focusing on how SouthSouth Cooperation from WFP in Brazil has promoted several health instruments in the country. And then we move to the end for some reflections and lessons learned from that cooperation on school feeding as health tools. So just here. Okay, so to start, we would like to present, I'm sorry for this, It's not changing. Okay. Okay, I'm sorry for that. So to start, we would like to present school feeding as entry points for health interventions. WFP in general says school feeding as a multi-sectoral approach. That means school feeding is not just providing food to kids at school premises, but school feeding programs are an umbrella programs, a safety net initiatives that talks to several sectors such as education, agriculture, social protection, and also health and nutrition. WFP programs and the national programs we support, they have this approach on health aspects that goes all the way to the first, what we call the first 8,000 days of a children's life, which would be at least the first 21 years of life. For that, WFP always advocates for school feeding as entry points for health intervention, because all investments made today means that children entering school at school age today in 2030 are going to be adults. So if you invest right now in those kids, within 10 years they're going to be better skilled adults, and also well-developed humans with well-developed social capital and human capital. And how does school feeding contribute to that on health and nutrition aspects? School feeding addresses most of the children's hidden hunger and diseases, not only because school feeding programs provide balanced and healthy meals every day throughout the whole 200 school days per year, but also because a lot of interventions are attached to school feeding programs, such as deworming programs, school health campaigns, and food and nutrition education. So not only school feeding promotes better diets for the children because they have access to food, but also it promotes how to utilize food, on improving eating habits and promoting also health access, using schools as entry points. And that's what we want to highlight from the Brazilian experience and the Kenyan one. How does WFP work regarding school feeding as a health intervention? WFP works mostly with capacity strengthening once you talk about health. WFP is an institution, international organization that works with food, not necessarily with health instruments, but all the food promotion we have, the food assistance programs, they talk to health and nutrition. Because most of the aspects, once we want to develop a country, we want to develop social and human capital, we need to make sure that kids have good health and nutrition aspects. And one aspect that school feeding mostly addresses is that healthy children learn better. So in order to do that, capacity strengthening will focus on two aspects of a country's development. We are talking about institutional development and individual development. By institutional development, we are talking about policies, legal instruments, strategies that can organize and address health components within a school feeding program. When we're talking about individual capacities, we're talking about mostly about training on how we are going to apply and use those policy instruments and legal instruments within the school feeding programs. And by that, we mean training teachers, professors, school principals, and also having food and nutrition education for kids. So for example, Yasmin is going to present on the Brazilian experience and how that experience has been applied to the Brazilian program. So WFP believes that by having one country experience being shared with another country through SouthSouth Cooperation, we can enhance both the government capacity to understand and analyze and develop tools, but also for the practitioners on the ground, and by that we are meaning education and health national agents, to talk to schools and bring health components into the school feeding program and applying those toolkits to the students. Another important aspect, once to talk about food and nutrition education, both in Brazil and now in our example in Kenya, it's important to say that usually kids will take those examples back home. So by that, we have another multiplier effect. So we not only are addressing directly kids, but also indirectly, we are also addressing families. And usually those that receive the information and start applying that information to the families are the mothers. And that's why we chose to present school feeding as a WFP instrument and a national instrument to use to bring health into the schools. Now I'm going to pass the word to Yasmin, who's going to present the WFP Center of Excellence work, and then on Brazil.
Okay, thank you, Bruno. Let me just, okay. So before we delve into more details about school feeding and its connections to child health, I'd like to talk a little bit about the Center of Excellence work and what we do here. The WFP Center of Excellence Against Hunger was created in 2011. It is a partnership between the World Food Program and the government of Brazil. And the center was created mostly to share with other developing countries Brazil's successful experience in fighting hunger and poverty, mostly through the so-called Zero Hunger strategy, which I will talk a little bit more about in a few minutes. The WFP Center of Excellence in Brazil has now become a hub for SouthSouth Cooperation. We work mostly on food and nutrition security and school feeding programs, as Bruno was saying before, as platforms to promote development in African, Asian, and Latin American countries. In 2018, we have provided continuous technical assistance to 17 countries by working with their governments and with WFP country offices to build national capacities and implement effective school feeding programs. And this translates into a little over 4 million children benefited. Now, it is also relevant to explain why we have been sharing so widely the Brazilian experience in fighting hunger and poverty. So in 2003, the Brazilian government launched the Zero Hunger strategy, which is an integrated structure that's composed by a series of programs, which are in different areas, but all with the ultimate goal of fighting hunger and poverty in Brazil. The strategy is composed by 4 main axes, which are promoting access to food, strengthening smallholder farming in the country, implementing programs that contribute to income generation, particularly in rural areas, and at the same time, guaranteeing multi-sectoral coordination between all the ministries and areas that implement these programs with civil society participation in decision-making, oversight, and deliberation processes. Now, within this first axis, access to food, we would find some of the most notorious Brazilian social protection programs, such as the Conditional Cash Transfer Bolsa Família and the National School Feeding Program. The National School Feeding Program in Brazil, PNAE, is a program with universal coverage, which reaches over 42 million children nowadays. The program also has specific nutrition objectives, as in contributing to fulfill at least 30% of children's daily nutritional needs through menus that are planned by nutritionists, according to regional eating habits, children-specific restrictions, and food that is available for purchasing locally. The program also uses strategies to promote nutrition education within schools, and as Bruno said, to contribute not only to children's, but also to their families' improved eating habits. And finally, the program is integrated with local food production, which is what we call a homegrown school feeding model. This means that as far as possible, schools purchase from local smallholder farmers. Some of the elements that were essential for PNAE to become a model for several countries around the world are the ones listed in this slide. So firstly, the program has a very strong legal and policy basis, which helps to guarantee its maintenance throughout governments with different priorities. The program is based then on the right to food, which is enshrined in the Brazilian Constitution, on the 2009 National School Feeding Law, and on a series of policies, but mostly in the National Food and and nutrition policy. The second important element here is that the program has stable and continuous financing. Third, it is well integrated within a broader social protection strategy or package, which, if that's coordinated efficiently, of course, can help the program to fulfill its potential in reaching multiple benefits in areas such as education, gender, nutrition, health. Another key element is that although this program is universal, it is adapted to regional needs. And finally, the program's implementation foresees social participation all the way through, including parents, teachers, beneficiaries, and communities having inputs in school menus, for example. Now, what are the specific elements that help to promote children's health and nutrition through school feeding, speaking particularly about PNAE? So we can divide these up into three main axes. So the first one speaks to having specific food and nutrition guidelines on which the program can be based. As I mentioned before, Brazil has managed to create a strong legal and normative basis for this program. So you have public guidelines, as the ones listed in the slide, that help to shape nutritionists' work in schools and what they will or will not include in school menus. Now, regarding the menus, which is the second axis, one important aspect of the Brazilian program is that they are planned by a specialized professional, a nutritionist that is hired by the state. And there are a few elements that should be considered when planning these menus, of course. So first, there are certain rules and restrictions to be followed, such as serving at least 3 portions of fruits and vegetables per week, restrictions to the amounts of sodium, industrialized food items, sweets, low nutritional value drinks, such as sodas, for example, are prohibited. And then, as I mentioned before, you have to consider regional eating habits, children-specific restrictions, and also the food available locally for purchasing. There are also a series of initiatives that are listed here that nutritionists undertake with students in schools to identify their special needs in terms of micro and macronutrient deficiencies and children's acceptability to the food that's being served. And then finally, going to the third axis, one important type of initiative in changing children's eating habits and is including nutrition education within the subjects that are taught in school, so within the school curriculum and textbooks, as well as promoting extracurricular activities so that children can actually learn from the food that they're eating. And one example of that is school gardens, which have been widely implemented in other countries as well. Now I'll pass it over to Bruno, who will talk a little bit about our cooperation with Kenya and how these nutrition elements have been included in their own strategy for school meals.
Okay, so in Kenya, and why you're bringing this example into our presentation, Kenya is a middle-income country in Africa, one of the countries with a program that is very well structured and is being handed over from WFP to the national government of Kenya. And one important aspect of Kenya is it has a whole set of institutional and legal frameworks already in place that organize the school feeding program and integrates the school feeding program with not only the education sector, which is usually the leading sector for a school feeding program, but also with agriculture and livestock, and with the health sector. Just to go through a little bit on the Kenyan program and how it works with health components, one important aspect is Kenya program is over 30 years old. It comes from 1980. So between 1980 to 2009, the Kenyan school feeding program was run by the World Food Program, the country office. Between 2009 till last year in 2018, that was what I call the transition stage. So during that transition stage, SouthSouth Cooperation played a very important role in how we could structure the program and capacitate the institutions that would run that program, and how those institutions would prepare the ground for the individuals to be also capacitated, to have their capacities strengthened as well. So the Kenyan school feeding program is what we call a homegrown school feeding program. That means it buys locally, food produced locally, which means we are talking about food that is they are fresher. We're not talking about imported or industrialized food. We are also considering the school feeding program can use fruits and vegetables and local animal protein bought locally, which contributes a lot to the health and nutrition aspects of the program. All the funding comes from the government, and the aspects I'm going to talk about, and which I think it's really important to talk about today, is on policy and legislation, most specifically on their strategy, which was largely influenced and contributed by the Center of Excellence in Brazil, and also by WFP headquarters and the country office in the country. So based on the three axes Yasmin was talking about, all of them are present in that strategy. One important aspect of this strategy is to bring in what we call nutrition sensitive school feeding program that goes throughout all the three sectors of the program. So here we're talking about not only designing nutrition sensitive menus to tackle not only the specificities of, for example, wasting, stunting, and anemia, but also how to promote food and nutrition education, how to promote better eating habits, for example, having fruits and vegetables in the school menu, and how the micro and micronutrients that are in those foodstuff can contribute to the development of those of the school-age children. We are talking about as well and coordinating with other ministers, because once the program was first introduced in the country, we just have the Ministry of Education leading and implementing and delivering the program. Once we had that strategy, what happened was all the food and nutrition policy and the health policy, which were also influenced by the Brazilian experience in food and nutrition security and health policies, they were brought into the school feeding program. So all the guidelines, all the approaches, all the toolkits from the health and nutrition sectors in the country were brought into the program, and they were started to communicate with the education sector. And lastly, we had the agriculture sector. So to inform and to seek food produced in a country that could be nutrition sensitive, so nutrition sensitive agriculture as well, food that could address the needs of the school-age children in Kenya, which still suffer, even though Kenya is a middle-income country, of hidden hunger and non-communicable diseases. So all those health aspects they are present in a strategy, and they came a lot in many aspects from the Brazilian experience. What I want to present right now is how SouthSouth Cooperation contributed to that process, and how some of the activities, the major activities, not only the WFP Center of Excellence in Brazil has conducted with Kenya, but also WFP as a whole. Then I'm talking about headquarters and WFP country office in the country. So how we introduce health sector approaches into mostly on a food assistance and the education sector. The first aspect to have engagement with stakeholders across different government sectors, and then we brought in health, agriculture, and nutrition sectors from the Kenyan government. They have several state visits to Brazil and other countries on the African continent. So to mobilize and promote advocacy to those health and education and agriculture actors, to show them that all sectors have similar importance to the school feeding program. From that point on, we started to have consultations and multi-stakeholder validations on how those sectors could communicate and better integrate their actions in the school feeding program, and that's where the strategy idea came to the floor. So we had the health professionals talking about the health and nutrition policy, the education sector talking about the education policy and their 2030 vision for education. And we're starting to have knowledge exchange with the Brazilian authorities through the Center of Excellence in Brazil. So we started to organize all the knowledge in place, both in Brazil and in Kenya, and to organize a strategy that could address all the knowledge we had in place and how to implement that knowledge in the program being handed over by WFP. From that point on, we had all the strategy design, the capacity strengthening support, and then we mean the institutional one, how the institutions could create coordination, how they could develop better tools to implement the strategy and the policies already in place. Then we had government workshops, which are really important to create a buy-in from all the sectors and also from the agents who are really going to implement the program on the ground. And then we continued exchanges from Kenya with other countries. WFP Center of Excellence in Brazil also support. For example, last year we had a very interesting exchange between Kenya and Namibia. So Kenya was showcasing its strategy to another African country, how it integrated health and social protection aspects into a feeding program in a country. So that's pretty much the overall idea of how we did that from the Brazilian experience into another country in Africa and how it has been implemented so far. So I'm going to head over to Yasmin right now so she can present the lessons learned from all those exchanges.
Okay. So in closing, having gone through these examples of how the Center of Excellence in Brazil works with countries through SouthSouth Cooperation, we thought it would be important to highlight some of the trends that we have identified throughout the last 8 years of the center's work in our attempts to promote health and nutrition through school feeding programs. So firstly, we have seen countries increasingly including nutrition elements in their programs, and that's important. Most of the time, this will be reflected in sectoral policies or even laws in some way, which will either specify their general aim to contribute to nutrition, or more specifically, some will go into the food portions and nutritional values that should be served in school meals. In spite of these positive developments, more investment is still needed to maximize these programs' contributions to health and nutrition. We know that several countries are still not able to serve fresh food and to purchase fruits and vegetables from local smallholders due to several issues such as problems with storage, program financing, program continuity. And also we know that broader connections to school-based health services are needed as well, but infrastructure seems to be a problem there. And finally, our experience is that when school feeding programs are integrated within broader social protection schemes, and when different government areas are well coordinated to run this program, they have a higher chance to reach their full potential of multiple benefits in several areas. So that's it from our side. Thank you very much.
Over to you, Chris. I can see that Chris is back. Dr. Chris, are you back? Dr. Chris, we cannot hear you, but you are online. Okay, so we couldn't hear Dr. Chris. Dr. Chris is based in Manila, so this is the challenge of global connection. But this is really still a very good initiative to bring different practitioners together from different parts of the world. May I just remind the audience that you may type the questions in the chat box if you have any question, and we will address this after all 3 presentations. Dr. Chris, are you back? Okay, so let me then, we will proceed to the 3rd presentation. We have Dr. Alyssa Sharkey. She is currently the Senior Health Specialist in UNICEF headquarters. And before that, she was the Regional Health Advisor in South Asia on maternal and child health. And she will be talking about that experience on a South to South initiative in the area of health. Dr. Sharkey's current focus areas are on equity and immunization, implementation research for the improvement of health programs. Alyssa, over to you, please.
Great, thank you so much, Martha, and thank you to the organizers of this webinar. It's a pleasure to speak with all of you about the experience of South Asia's South-to-South Collaborative for Health. This initiative was started under the previous regional health advisor for UNICEF there, Dr. Douglas Noble, who's now with the China Country Office, and is now under the leadership of Dr. Paul Rudder, who's the current regional health advisor. Next slide, please. So the two figures on this slide come from the new global report of levels and trends of child mortality, which has just been released in September. And it illustrates where South Asian countries are with respect to child mortality. So you can see from this figure on the left, the annual rate of reduction in mortality rates for Central and South Asia, showing that there have been important gains in reduction since 1990. And even since 2000 in reducing newborn child and older child mortality. South Asian countries have gained considerable experience and knowledge and have implemented a range of innovations that have contributed to this progress. However, as you can see from the map, the countries in the region still face some significant challenges with some of the highest mortality rates in the world. And in South Asia represents 1/3 of all deaths to children under 5 globally. Next slide, please. So as early as 2013, the Regional Office for South Asia, which we call ROSA, supported country-based colleagues to participate in opportunities for capacity strengthening through training workshops, country-to-country exchanges, and peer-to-peer learning around priority topics concerning maternal, newborn child, and adolescent health. In 2015, ROSA formalized the South-to-South Collaborative for Health using internal funding, which provided some flexibility to the regional office to support this innovative work. The office appointed a regional South-to-South coordinator in our Sri Lanka country office to oversee the activities. She spent most of her time doing that, but also functioned as the country office's chief of health for the remaining portion of her time. Next slide, please. The aim of the initiative is to address health system challenges by building on good practices from South Asian countries and enhancing collaboration and exchanges of knowledge among various professionals working in the field of maternal, newborn, child, and adolescent health within the region. There were 3 objectives, and these were improving learning and communication between countries through in-person exchanges, trainings, and follow-up activities, strengthening the skills of health practitioners and providing an opportunity for learning and sharing among policymakers. And third, fostering self-reliance in countries by enhancing their ability to find country-specific solutions to health problems corresponding to their own aspirations, values, needs, and priorities. Next slide, please. The South-to-South approach is one of active collaboration amongst a variety of partners, including program implementers and decision makers from government, regional organizations, civil society partners, academia, and the private sector. And we define South-to-South as a process whereby 2 or more countries could pursue their individual or shared national objectives through exchange of knowledge, skills, resources, and technical know-how, and regional as well as inter-regional collective actions for their individual and or mutual benefit. UNICEF has organized exchange visits, trainings, and webinars within and across regions. Next slide, please. A few of the trainings and exchanges that have taken place over the past few years include when teams from Afghanistan visited India to learn about quality of care and India's special newborn care unit real-time monitoring system. In another visit, teams from Afghanistan visited Sri Lanka to learn about the maternal and perinatal death review system there. In addition, the Regional Office for South Asia team conducted a training on costing of every newborn action plans for participants from all South Asian countries. Next slide, please. In 2016, an interactive training on advanced pediatric life support was held in Sri Lanka for health professionals working in the area of newborn care. And this training was done in collaboration with a team of specialists headed by 4 Australian doctors as well as Sri Lankan doctors who'd been qualified in advanced pediatric life support. Next slide, please. Another example is when the ROSA team, the Regional Office for South Asia team, collaborated with our colleagues in UNICEF's East Asia and Pacific Regional Office program to bring Pakistan medical professionals to Vietnam for a training on the benefits of early and essential newborn care and on kangaroo mother care, which is an approach used to provide thermal care for and improve the survival of low birth weight infants. This training enabled the Pakistan participants to become kangaroo mother care master trainers. And as a result, a kangaroo mother care room with 4 beds was established in the gynecology ward of the Service Hospital in Lahore, Pakistan. Early and essential newborn care was also established both remotely and in person. Next slide, please. Since the initiative began, the South-to-South activities have led to other important in-country policy and program changes as well. So for example, following its exchange visit to learn about maternal and perinatal death reviews in India, Afghanistan conducted multiple trainings and established maternal and perinatal death reviews in 2 maternity hospitals and the largest pediatric hospital in Kabul. Following a workshop on home-based records for immunization in Sri Lanka, India revised its federal home-based records, and Nepal and Afghanistan redesigned their vaccination cards in collaboration with their respective ministries of health. And as a result of a South-to-South training on immunization, cold chain equipment repair, maintenance, and management that was held in India, participants reported subsequent work to repair their equipment, including one cold chain technician from Bhutan who said that within 15 days of returning home, he was able to fix equipment which had been non-functional for more than 3 years. Next slide, please. So I'm sure you can imagine, a considerable amount of work went into planning and carrying out each training, webinar, and exchange visit, as well as monitoring subsequent in-country activities. So here's an example of the types of tasks we engaged in a typical exchange visit. I won't go through all these tasks listed on the slide. Hopefully you will be able to access the slides following this webinar. But these might give you a sense of what we did both prior to and following the activity itself. And I just want to emphasize the follow-up work that we tried to do with participants at periodic intervals, such as 3 months or 6 months post-visit, to really determine how the learnings were being used and implemented within programs. So ensuring adequate funding for each activity was another challenge for us, and at times it did require some creativity from our side. Next slide, please. So just in summary, through active collaboration with practitioners and with strong engagement of our government partners, UNICEF's South-to-South Collaborative in South Asia has been very successful in identifying challenges, pioneering new areas of collaboration, scaling up existing capacity building opportunities, and documenting and sharing good practices among country teams within the region. The initiative has been quite successful, and countries in the region continue to organize country visits and request trainings and technical assistance on topics that have been identified by government partners and practitioners as critical to their work. The approach is relevant and applicable to a broad range of issues, even beyond maternal, newborn, child, and adolescent health. The key, I think, is that this work should really focus on topics that can facilitate solutions to existing priority challenges faced by the participating country or countries. Next slide, please. And just quickly, I'd like to acknowledge the team that was critical in getting the initiative going and carrying out many of the trainings. Next slide, please. Thank you. That's all from me.
Well, okay, where is that? Thank you so much, Alyssa. And may I invite now all the presenters to switch on their camera again for the Q&A. So thank you to all the presenters. This is indeed a very, very rich discussion. And one of the general question is speaking from our objectives. So we met our two objectives of bringing the practitioners and SouthSouth Cooperation colleagues together, especially in the area of promoting mother and child health, and to share the different modalities that countries are using. And one comment that we would like to hear from all the presenters is how do we continue this dialogue and discussion so that the initiatives are will sort of come together, especially at the country level. We have some questions for all the presenters. So I'm just going to read them out, and then I'm going to hand over to the presenters to respond to the questions. So one question for Dr. Cao. We have, what do you expect or would like to see from your partner countries for them to benefit fully from the training that is being provided by IHECC? To Ms. Lily, from your experience in providing training to partner countries, what did you find most rewarding as a professional and also for China as a provider country? We have several questions for WFP. What are the contributions from the government of Brazil in kind and in funding in terms of running the Center of Excellence? And also, what are one or two specific actions that the Center of Excellence is conducting regularly to support capacity building, and how is this funded? There is also a question to WFP on one of our participants would like to know to what extent the new government policies and lower economic growth could impact the continuity of the program and the exchanges. So with those, let me start with Dr. Cao. Dr. Cao, you have the floor, please. Okay, so we don't have Dr. Cao yet. So Lily, could we will start with you. You have the floor, Miss Lily. Lily, we are not getting your audio. No, okay, so Lily is coming from, as presented from the Hunan province, and I think the connection is not very good at this time. So can we start with Brazil, please?
Yeah, of course.
Sure. So addressing the first question, how is Brazil Center of Excellence funded? Most of our funding comes from the Brazilian government, from the Brazilian Cooperation Agency and the Ministry of Education in Brazil, who finance most of our activities. But the Center of Excellence also works from funding, from grants and projects from the countries we work with. Regarding the second question on actions we are supporting regarding country capacity strengthening, today the Center of Excellence in Brazil supports 18 countries in Africa and in Asia. We had already more than 30 countries being supported by the Center of Excellence, but today just 18. What do we do regarding country capacity strengthening? From there, we are talking about not only in presence technical assistance, but also remote assistance. And most of our activities go from advocacy, policy advice, technical assistance, to more specific activities such as resource mobilization, project design, program policy preparation for design, implementation, and delivery, which we do mostly in partnership with the country offices and WFP regional bureaus. Our country capacity strengthening activities are mostly concentrated on what we call the environmental domain and the institutional domain. That means we are talking about very high level policy dialogues to sensitize, to seek for funding, to prepare programs and projects at a very political level. And we are talking about institutional capacity strengthening. That means we are talking about the ministries, we're talking about the secretariats, we're talking about the agents and WFP offices on the ground, and the technicians, the practitioners, and the agents on the ground, and how they can implement a program that has been designed by a enabling environment coming from all those policy advice and advocacy issues. So today, again, we are talking about 18 countries. Most of them already have policies and institutional and legal frameworks in place, and we are moving to the implementation side of most of those programs in Africa and in Asia. Our most important next step is on how we can implement and deliver those programs, but also how we can integrate health and nutrition aspects, and also seek for stable budgeting and financing for those programs that are being handed over from WFP to the national governments.
Yeah, I mean, if I can give a quick example, this is something that we're doing, for example, with Lesotho right now. So they do have a national school feeding program, but it's being run partially by WFP and partially by the national government. What we're doing is we're working in partnership with the country office and with the national government to build the government's capacities, restructuring their internal management systems, secretariat for school feeding, etc., to make sure that they can fully implement the program, the national school feeding program, and that WFP can hand over its schools, the schools that it's running, to the government. So that's one practical example of that.
Okay.
Yeah. And there was one last question about how government policies and low economic growth influence on, to what extent that influences on the continuity, right, of the collaboration. Of course, this has a very big role in whatever we do. This is why we say we work directly with governments. If you do not manage to get government's will and collaboration to develop those programs, well, then you're not able to do anything. So, I mean, that's why we work so hard, and we have been working so hard within the last 8 years on the advocacy side, on convincing governments that school feeding is important, that school feeding should be implemented for multiple reasons, all the benefits that we presented here. So this has been a great part of the Center of Excellence's work, which moved towards implementing laws and policies within the countries to try to maintain these policies, even though governments will change and their plans, I mean, their priorities will change as well. But if you have something that guarantees that these programs exist and that they have secured financing, particularly through laws, that's something that can really help you guarantee that the programs don't end even though government changes. And there, of course, I mean, funding is a huge issue in implementation. We know that. We have been dealing with that with several countries. But there are ways to not only seek donors' assistance, but to generate income within a government through specific taxes that can be used to fund social protection programs. So there are some tweaks that you can do with for funding to generate income within the government so you can fund those programs.
Thank you, Yasmin and Bruno. Lily, are you online? And Dr. Cal? If not, Alyssa, we have one question for you. In terms of the excellent work that has been done in South Asia, how do you see this kind of work being integrated in the policy of a government like China as a provider country for South-South Cooperation for Health? In other words, in addition to China, for example, do you foresee other governments who could be taking the lead in terms of a provider country, in terms of capacity building and providing technical assistance to countries in the Global South. Alyssa, over to you.
Thanks so much for the question, and I think it's a fantastic idea. The model demonstrated by China and leading this work is really exciting. I would hope that it can be expanded beyond. South Asia provides an interesting, it's an interesting region because we have countries in that region that are doing very well, like Sri Lanka. And then we have countries that are really have significant challenges, like Afghanistan and Pakistan and India and some of the disadvantaged areas of the country. So there should be an opportunity, I think, to pursue that type of relationship and in creating a stronger role for government partners. The challenges we found for UNICEF, when the country is doing really well, our programs, for UNICEF at least, ramp down. So that's particularly something that's happened with health in Sri Lanka. The funding for that program has really declined, and of course, there are other priority areas within the country. So it's a challenge for us. I think it'd be welcome, that kind of relationship, and something that UNICEF should certainly explore within the region.
Thank you so much, Alyssa. Lily, over to you. Please unmute the microphone. Lily, the microphone is still muted.
Hello?
Yes, we can hear you. Go ahead, please.
Okay. So I think this is the golden time for us to be involved in the SouthSouth Cooperation. The Chinese government, they put forward a lot of good policies to support to focus on the MCH globally. So as the organizer, the one of organizer in China, we really receive a lot of support from the government, and to start a lot of collaborations to work with other countries. So we are really enjoying to do more in the future, and also we are expecting more suggestions and advice from other partners. So yes, I think as the organizer in the future, we will play a very important role to conduct very technical programs, because we are the hospitals. We always to focus on very professional areas, like some technical projects, neonatal resuscitation, and I think all this kind of the technical support is very necessary for those other countries. In addition, we also need to learn from other countries, like the organizing
Lily, we lost the audio again. We are now down to the last 3 minutes of our webinar. We aim to finish at 9:30. So we will wait if Lily will be able to come back. If not, I would just want to thank all the presenters for this wonderful presentation. We want to think that this is the beginning of connecting the different initiatives for promoting for sharing the experiences in the maternal and child health, and leveraging fully the power of South-South cooperation to share these experiences and these success stories. We have heard the different modalities used by different countries and partners. Lily, are you back? We lost you a while back, so I will be closing the webinar. Before that, I will ask all the speakers to say a final word, but the recording of the webinar will be posted in our community of practice. So again, we invite you to join the community of practice on SouthSouth Cooperation for Children. It is hosted in the socialprotection.org that is managed by our colleagues in the International Policy Center for Inclusive Growth, IPCIG. And let me take this opportunity to thank Karine and colleagues, Anna, Alina, who are providing the backup in organizing this support. And of course, from my team here, Hansol Yang. We will also share all the questions that you submitted to the speakers so that this could be addressed via email. And for follow-up, we will try to make sure that this first initiative to bring together the different partners is just the beginning of bringing together all the initiatives to promote success stories in maternal and child health through South-South and triangular cooperation. Before we close, Chris, you are back. So why don't I give you the floor, and then to all the participants, to all the presenters, to say a final message, to give us a final message. Thank you. Chris, over to you.
Oh, thank you very much. Sorry, I'm lost. I lost many times, but I could see the presentation, and they are very much extraordinary informative. And thank you very much for joining the webinar today, and all the panelists, excellent. I also think South-South collaboration is not a one-way approach. Two-side learning is always learn. I also participate many South-South collaboration opportunity. I also learn a lot from two people's or two-sided collaboration. I think we should pursue more, and this tonight's experiences and is also very informative. Thank you. And over to other panelists.
Alyssa, let me start from this side.
Thank you. Just to welcome any contact from any of the participants who would be interested to hear more, and I can put you in touch with the right people, but I'm happy to answer additional questions or connect off following the webinar. Thank you so much.
Thank you. Yasmin and Bruno.
Yeah, okay, so we'd like first to thank UNICEF a lot for the invitation and thank all the presenters for the very informative presentations. I think at one point we had a question about how do we continue this collaboration, and we really hope that we can use this community of practice hosted at socialprotection.org to continue speaking about this topics. It was a great opportunity for us to speak about our work from a different perspective, a health perspective. So yeah, thank you very much.
Thank you so much. Lily?
For inviting me to join this webinar. I learned a lot from all of you. So this is the first time for me to join this webinar, and sorry for the poor connections. So maybe I'm not doing very good. Sorry, but
no,
we can keep in touch. Any questions you can contact with me.
Thank you so much. Dr. Kao, are you online? Okay, we don't have. So on behalf of UNICEF and the other and our organizers and SSC and IPCIG, we thank all the presenters and all the participants. We have up to 45 participating colleagues in this webinar. So we will send you also the data, the information on who participated and their contact addresses. Thank you so much, and good evening, good morning, and good day to all. Bye.
Bye-bye.
Bye, thank you.